My name is Professor Liz Hughes. I'm Deputy Medical Director at Health Education England, with responsible for undergraduate education and foundation. And I'm also the Disability Lead for Health Education England. I'm proud to have been a disability champion in a number of NHS trusts, working with others to consider the practical steps we can make to make our working environment more inclusive. I've had personal experience of the support that the Access to Work funds can give in making a person's working environment much more effective. I had great difficulty in outpatients with the just the setup of the desks, chairs, and examination couches with my disability, and an access to work assessment was incredibly helpful and enabled me to be given the appropriate setup in outpatients to allow me to work effectively without difficulty. And I think it's really important that people understand there is a significant fund that is there for any employee to access to make their working life much more effective.
Hello, I'm Piers Wilkinson. I'm the Higher Education Policy and Campaigns Lead for Diversity and Ability, which is a disabled-led social enterprise. I was also appointed to the Disabled Students Commission, which oversees disabled students' education and produces guidance within England. And I am one of the project leads for the HEE partnership that we're working with them on, which we'll get onto in a little moment. As a disabled person going through education myself, the Disabled Students Allowance was a vital lifeline to be able to continue in education, but also to achieve grades that would reflect my ability. And that support was in many ways the reason why I was able to continue on to where I do and the work that I do today. It allowed me to first understand why I was encountering challenges, and also then provided that support, that funding for the equipment, for the software, my assistive technology software, as well as for transport, for taxis, getting from A to B, so I could be there on time, so they could deliver and ensure that my education was being utilized to the best of my ability. And it also meant that my colleagues around me and my lecturers and my teachers and trainers understood a little bit more about disability as well, and influenced them in being better practitioners and being better educators, because I was getting the support that I needed, and that meant that they would then be able to get the support that they needed to support me, whether that was with the content material being accessible for my screen reader, or ensuring that the assignments that I was getting were in a way that meant that I was able to complete them and they were able to understand what I was doing in the first place. So the Disabled Students Allowance and Access to Work are these critical support funds provided for disabled people to access, and navigating them can be incredibly challenging, and the time process to access them can be difficult. So that's why this resource is so helpful in ensuring that every one of us gets the support that we deserve to be able to achieve and be productive and attain to the best of our ability.
I've led HE's work in widening access and participation into medical careers, and have worked also with the system and HE colleagues to improve flexibility and support for doctors. But last year, I had the honour of chairing HEE's roundtable on supporting medical students and doctors with disabilities. And this led us to understand what good practice was available, but also we wanted to think what else we could do at HEE to support all learners who are disabled, not just doctors and medical students. And I think in a year that sharpened focus on health inequalities, with the disproportionate impact of COVID on people living with long-term conditions or disabilities, this is now more important than ever.
So HEE reached out to Diversity and Ability based on the work that we've done previously to partner together as we are a disabled-led organization to create a user-focused resource for disabled learners and doctors to ease in that transition in accessing support. So this beta resource that we've created is a little bit of a guide on how to access disabled students allowance and a little bit of a guide on how to navigate and access to work for when you are in the working environment within a trust. The resource itself has quite a few interactive videos. One with Professor Liz Hughes as well, and a couple of other people talking about experiences, talking about those lived experiences that we champion here at Diversity and Ability as a core part of the work that we do. And that's really what has been driven this particular project forward, has been by disabled people for disabled people. The ethos around this has been using lived experiences, engaging with disabled doctors and learners within the healthcare professions to build this resource and to make sure that the language and the nuances that you experience in your everyday has been built into this and is helpful for you. As such, the one thing that we want to ask everyone to do is check out this resource, engage with it, look through it, listen to the videos, watch them, and share it around with not just your disabled colleagues and students, but with your line managers, your HR professionals, and your senior management, because it's not just disabled individuals navigating the process that has to understand this, but there's a massive amount of benefit to everyone in understanding how your colleagues access support and what that support looks like, so that we can build that cultural difference within the NHS and within education to better support inclusion of disabled professionals and learners. One of the other things is this is a beta resource. We're still in development. We're still building on it. And the big thing we would like you to do is provide us feedback. There's links on the page itself, or you can get in contact with us directly to share us your opinions, to share your thoughts, provide us where you think it needs to be better, where you think it works already really well. And give us that development information so that we can make it a resource that truly has the impact that we all know it needs and deserves for disabled colleagues and professionals within the sector.
So it's really important that we start to share this tool. It is, as Piers has said, still in development, but we've already done a huge amount of work on it. We're really grateful for your feedback and how we might further improve it. Particularly from your disabled trainees and students. But also, we would like you to widely share it with managers, with people who will be supporting your learners and trainees in their education and training. And as medical educators at DMEC, I think it's really important we make a really big effort now to signpost people to this resource, because there is a fantastic opportunity for us to support our learners who are disabled to actually access the workplace in a much more supportive way. And this is the beginning of the journey. We'll be extending this to non-medical learners in the next few months, so that everyone will be able to have access, both students and trainees, to help and support them in their working life.
Thank you so much for having us here at DMEC and listening to us. And just to reiterate, the three things we want you to do is share this with your colleagues and other professionals and other students, check out the resource in the first place, provide us with the feedback that we need to develop this further, and we can support each other and support you with your stressful time as postdoctorates and the stress that you're going through, to make sure that we all have the support that we need to excel and make health education and the NHS more inclusive for everyone to enjoy.